I'm by Randy here and ready to talk about chronic pain and mindset. Topic is chronic pain and mindset. So again, a little bit about me, physical therapist for over 20 years and a posture alignment specialist for about 5 years now. And so I find mindset is a big part of people's recovery and healing process. To business here in terms of sort of the definition of what makes something called chronic pain versus just an acute pain or something else. And so it is a pain that is persistent or recurrent over 3 months or. The study in Europe, and the biggest cause of chronic pain is back pain. So many of you, or somebody you know, I'm sure, are suffering from chronic back pain. I know plenty of people, obviously, in work and out of work. So chronic pain affects over 100 million Americans, and that is more than heart disease, cancer, and diabetes combined. So we know those are some big diseases that we worry about, but chronic pain is huge. We know there's been an opioid epidemic, especially in the state of Florida. So that's one of the things where we bring into how can we consider the mindset side. And many of these back pains in this European study that I was just listening to something about, was talking about that there isn't a medical explanation for a surprising 90% of people with back pain. So meaning there isn't something that can easily be done to resolve it. And so a lot of times it's analgesics or painkillers that are offered. So that is why we want to consider the aspect of mindset, and why I added posture therapy to my practice and my toolbox in addition to physical therapy. Again, it was watching different people deal with different symptoms over the years. So there's a big overlap between chronic pain and depression. And so they're kind of like, it's sort of the chicken and the egg. It's kind of like which came first. And again, depression is so much more accepted today as something that happens and so many people suffer with. And so those two things do go together, and they can feed into each other. When we talk about pain, and let's say you have a cut on your arm, and then you feel the burning pain, something like that. So part of that is the sensory system. The pain comes in, and the sensory nerves travel up to the brain and provide the information of what happened. So that's a portion of it, but then the brain processes the pain. So there's the normal sensory aspect, the part of the information going to the brain, but there's also a cognitive and emotional aspect of how we process that pain. So sometimes someone is suffering from a pain or an injury that the pain feels a lot worse than the average person with a similar type of injury, like a shoulder tendonitis or something. And we might see people and they commonly can't do certain activities and have a certain common pain level. And then there's people who experience that same type of pain, but so much worse, and it really affects their function. And that's where the brain and the mindset and the emotion are playing a factor in this. So we're going to talk about mindfulness. So mindfulness is non-judgmental awareness of the present moment. So this is something that a lot of times people will come in and say, I have so much pain. The pain is terrible. I can't sleep. I can't walk or do the activities I want. And then when I'm working with somebody, that same person, and we're evaluating, I'm like, what are you feeling right now? How much pain do you have? And right now, and they don't always have the pain at that moment. So it is really important about being present and being aware of how is your body feeling. And why mindfulness is the non-judgmental is just taking it in. Are you feeling pain currently, Or is your body feeling okay at a certain time, even though you're sort of worried that the pain may come? And a lot of the worrying goes into this catastrophizing and a lot of fear. So that's where practicing meditation and mindfulness help us sort of get out of those fear patterns that come, and we sort of can break some of those cycles of the fear and worry of what's going to happen and bringing that on. So different ways that people practice mindfulness or meditation. Another aspect is called the law of attraction, and that's where like thoughts attract other like thoughts. And so that philosophy is, if you are thinking, oh, I have so much pain and I'm really afraid it's going to happen, it's kind of spirals, and that also causes a chemical reaction in our body. And so that's where the sort of the adrenaline and different effects of different hormones that are released in our body can result in sort of a flare of things and that stress reaction in the body, versus when you're being mindful and we're focusing on your breathing and relaxing and letting tension go. That is releasing more endorphins and more calming chemicals in the body that can help promote healing, promote better oxygen getting to the different areas of the body to promote healing. So that just gives you an example of why are these so important. So another aspect we're going to talk about that's really fascinating is the placebo effect. And I think we've all heard of the placebo effect. We know about it with a lot of drug trials. And so just a definition for this one is a beneficial effect produced by a placebo drug or treatment which cannot be attributed to the properties of the placebo itself, and must therefore be due to the patient's belief in that treatment. And what is fascinating is that placebo cure rates are from 15% to 79%. So I guess it's a big variation. And so whenever they're doing studies on different treatment techniques or medications, they have to account for the placebo effect and the fact that if you give someone an injection of a medicine, but it's really just saline and people respond and feel good, that is the placebo effect. That's the mind allowing the body to relax. So we want to take advantage of that. And that's part of what I do when I'm working with someone, is helping them believe that their body can heal and that they can feel pain-free. And it's a really important aspect of recovery and dealing with chronic pain. Here's a little quote for you, is that placebo effects have been shown to be most effective for conditions like pain management, stress-related insomnia, and cancer treatment side effects like fatigue and nausea. And the reason why I say that is they were making a comment about it may not shrink a tumor, things like that. But we don't physiologically always know why. And sometimes it's muscle tension and muscle imbalance. And so if we are calming ourselves and using the thought process, we can help the body not react so in an overreactive way with our sort of mind and thinking. So something that Pete Egoscue talks about, that the Egoscue method was created by Pete Egoscue. I am trained by the Egoscue Institute as a postural alignment specialist. So he has a lot of theories that he teaches and that are really fascinating for someone like me who's a physical therapist and was trained one way and then sort of seeing things in a little bit different perspective. So he talks about pain is a signal from our body. And so a lot of times we see pain as a really negative thing, but pain is sometimes a signal so that we can know that something's off balance in our body. So we need to listen to it and sort of pay attention to what is going on in our body. And sometimes we want to just sort of run through it or work through it. Important to stop and listen. What can I change? And in postural alignment therapy, we work on creating an individualized method so that you can bring a more functional body into the activities that you want to do. So it's not necessarily blaming the activity, it's bringing a more functional body into it. And we stimulate the body with more balanced activities that allow the joints to sit better and therefore less causing of trigger points or pressure on a nerve. Part of this is belief that your body can feel better. So that kind of goes with it. So an interesting example that I heard Pete saying, and this is sort of how we approach medical care today, is he was saying, if you had a car and your car engine blew up and you went to the best mechanic in town and he said to you, you need a new engine, you might ask, why, and show me proof. Why at 30,000 miles, if the car only had 30,000 miles on it, why do I need a new engine? And we don't approach our bodies quite the same, sort of the way I feel like medicine is, and healthcare and insurance. We sort of take the word a little bit more of the doctors and what they say. And I'm included in that as a physical therapist, as sort of an expert in that. But I think we need to listen to our bodies a little bit more and get in touch with what are we feeling and sort of question that the same way you would with your car. And so in posture therapy, what we do with people is we do get in touch with what are you feeling right now, what pain is bothering you, and then we test it. We take the pictures of the body, we see what's happening, we go through some movements, and we see, is the pain happening with your body in this position, and then we test it different ways and we see, does the pain lessen? So we're sort of proving where the imbalances are that are causing the symptom. And that helps with our trust factor in the process, because we're sort of trusting our body. And I think that sort of ties up the whole mindset. Is one, it's just a belief that you can heal and get better. The practice of calming yourself and your mind so that you can produce better chemicals in the body, and then trusting it all and what you see, and making decisions based on that. And just because somebody says go have this surgery or take this medication, if you feel that's the right thing, great. If you don't, question it, do your research, test things out. So I see some different people on today, so I just want to kind of say hi.